Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Azhar Rafique, Assistant Professor, Department of Zoology, Government College, University, Faisalabad. The topic of my presentation is determination of prevalence and risk factors of infection with Babesia in small ruminants in Punjab, Pakistan. First of all, the introduction. Babesia are the protozoan transmitted by ticks, also called epicomplexan parasite infecting erythrocytes. Some species are zoonotic and affect human health. Clinical disease caused by Babesia species infection is characterized by fever, hemoglobinuria, and acute anemia. Also involves nervous system like in coordination, abnormal salivation, teeth grinding, and lethargy. Subsequently, death can also occur. Babesia is more abundant in small ruminants, sheep, and goat. Pakistan is the fourth largest milk producing country with the fastest growing dairy sector and from last several years as compared to other countries. Three species of genus Babesia, namely Babesia motasi and Babesia carassa and Babesia ovis, are responsible for disease in small ruminants. Babesia motasi and Babesia carassa are considered less pathogenic and infection is most subclinical, while Babesia ovis is extremely pathogenic and instigates severity of the infection with 30 to 50 mortality rate in sheep and goats. The current studies plan to detect Babesia ovis in naturally infected sheep and goat herds of Faisalabad, Toba, Singh, and Jhang district of Punjab, Pakistan. Materials and methods. A total of 892 blood samples in both seasons, summer and winter, from Ovine were collected, and the number of sheep 544 and number of goats 348, with a history of high fever or presence of ticks on the body residing in Faisalabad, Toba, Singh, and Jhang district in Punjab, Pakistan. Samples were taken in tube with anticoagulant, and the blood is mixed with 1 ml 90% ethanol and stored at 4 degrees Celsius for DNA extraction, PCR, nested PCR, blood smear, and hematological parameters. These are the primer sets used for Babesia ovis DNA detection. And these are the primers used in nested PCR. We also determine the hematological parameters. For example, PEX or cell volume, RBCs, hemoglobin concentration, mean corpuscular volume, etc. This figure then the results. This figure shows the photograph of sample showing positive result for Babesia ovis. This is the PCR product base pair 549 base pair. They show positive Babesia ovis. The M lane is DNA later 100 BP base pair. One is positive control, set 2 is negative control, and sample 3, 4, 5, 6, and 7 are for positive for Babesia ovis. This photograph of sample showing positive results for Babesia ovis by nested PCR. Lane M is the DNA ladder. One is for positive control, the second lane is for negative control, and sample 3, 4, 5, and 6 are positive for Babesia ovis. So we show the at 186 base pair. This table shows the prevalence of babesiosis in small ruminants in summer and winter season in 3 districts, Faisalabad, Toba, Singh, and Jhang. The overall prevalence in summer based on microscopic PCR and nested PCR was in sheep and goat or small ruminants, while in winter the prevalence is low as compared to summer. The prevalence of Babesia ovis in district Jhang was higher as compared to other 2 districts. This figure graph show the risk factors. The risk factors are the age, sex, feeding system, housing, and herd, body condition, and dog association. And the statistical analysis showed that tick burden weak body condition, closed housing, and um, association with dogs increase the prevalence of the disease. And conclusion, babesiosis were much prevalent in our sheep and goat herds that may lead to huge economic losses in terms of poor growth rate, poor quality wool, and increased treatment cost after disease outbreak. Smear method was not accurate for detection of carrier animal. PCR and STBCR for the detection of Babesia ovis was more specific and sensitive. Babesiosis sheep and goats were with significant decrease in HB concentration, PCV, RBCs, etc. It was observed that herds consist of more than 20 animals. Poor hygienic conditions associated with dogs and having ticks on their bodies were the major risk factor for the spread of babesiosis in small ruminants. Thank you for your attention.